Hi, everybody. Good evening. This is Allan Wright. I am the president of Zephyr United, and I'm here to talk to you about travel and what it's looking like right now. We, as many of you know, had been doing weekly video updates on travel during COVID, and we stopped doing that for quite a while because things were looking better and we were traveling again. And now we're facing the Delta variant, and there's new news, and it does affect travel, and it affects people's motivation to travel as well. So we thought we would do another one of these and see if we can provide some useful information for you, answer a few questions, and hopefully reassure you that it is still possible and safe to travel. I see a lot of people checking in with where they're from, which is awesome. We have 279 people that have registered for this tonight, so there was clearly a need. And we've got, I want to point out in the bottom center of your screen, ask a question. If you put a question into the chat box, I might not see it because I will be going through my slides, which I'll bring up in just a second. And the chat box will disappear, but I will check the ask a question box at the end to see if any of you have questions. I don't think this will take that long. I can't believe I'm going to be more than 30 minutes for my presentation. And then we can answer questions as they come in. So what I'm going to do now is share with you my screen. And I'm going to go right over to here so that you actually see it, and then I'll present. So hopefully you all can see this because this is what I'm looking at as well right now. What travel looks like right now with me. You all know, I think, who we are. We run Zephyr Adventures, which we've been doing for 24 years. That's our active tour company around the world. Taste Vacations is our food, wine, and craft beer tour company, also around the world. And Travel Montana is our new inbound tours to Montana, where we're based. If you have any questions later on, you can definitely contact me. I generally am not going to answer my cell phone unless I know what it is. But the email, allan@zephyrunited.com, is a great way to reach me, and I'm happy to answer any questions you have that you either forget or don't want to put on the public question area. I can't really talk about travel without talking about what's going on with the Delta variant, and I want to be clear that I'm not a doctor or an infectious diseases scientist. I do have an uncle who happens to be an infectious diseases scientist. It helps a lot. I do pay attention to the science. You all know that, or you probably wouldn't be on here paying attention to me. But keep that in mind that this is what I have learned from frequent, constant searching of what's going on in the news and occasional talks with my uncle. So the Delta variant is obviously, you all know, this is a repeat, but I want to make sure we're on the same page. The dominant variant in the US, I read something the other day that's saying it was 99% of one specific area's tests came back as the Delta variant. So it is the dominant variant. We all know it's more contagious. The CDC, this is where my data is coming from, says it's 2 times more contagious than previous variants. And that doesn't sound like a huge amount, but with exponential infection, that means it grows even faster. So that is extremely important. 2 studies have shown it has more serious effects than previous variants. We don't know for sure. That's not a lot of studies, but it is likely that it is more severe, not substantially so. We're still dealing with a virus that isn't killing masses of people in a percentage term. We're lucky that that's the case. If that were the case, things would be wildly different. Unvaccinated people are very high risk with the new Delta variant because of the increased seriousness and the increased contagiousness. So that's the most important thing. Because of that, cases are surging. We all know this, right? This is why you're all on this video right now. The current 7-day moving average of cases in the United States is 114,000. That doesn't really tell us anything unless you know what that compares to. So, according to the CDC, that's still 65% lower than it was on January 10th that week. That's good news. The reason it's 65% lower is because of vaccinations. Otherwise, we'd be at a new record high. If we had not developed a vaccine yet, which was entirely possible, that would take longer than the year and a half that really they were estimating at the beginning, we'd be in deep trouble right now. But the vaccines are working. Nevertheless, we're 883%, 8 times higher, almost 9 times higher than the low on June 19th. So that's this is the problem. This is why everyone's concerned. It is going up dramatically from where we were a couple of months ago. Also important to all of you, because I know that the vast majority of you on this call are going to be vaccinated, is that breakthrough cases of vaccination, vaccinated people are definitely much higher. Now, the CDC doesn't really track in whole breakthrough cases. They track breakthrough case hospitalizations and breakthrough case deaths and a few areas of breakthrough case infections, but not entirely. However, some states do, and I was just looking at the Colorado data, and it's clearly showing that cases of breakthrough infections, meaning infections of the COVID-19 virus in vaccinated people, are much higher than they were before Delta became common. We also know that symptoms are usually not severe for people who are vaccinated and get it. It can often be like a mild case of the flu, which is not that bad for most people, and that people are infectious for a shorter period of time. They are infectious, but that we don't know really how infectious they are yet, but it is for a shorter period of time, so that reduces the amount of people that you might infect if you are vaccinated and get COVID. And then it's also important that we don't really yet know, it hasn't been studied, how infectious you are if you're vaccinated and asymptomatic. And that's important, because if you are infecting people because you're infected with the virus but you don't even know it, then we're back to that original problem. We're going to have to do a lot more testing than we're doing now. Also, very important to parents out there and grandparents is that there are increasing cases and hospitalizations and deaths of youths. And this is extremely important for those people who are kids who are 17 and under, who are 16 and under 17, who cannot be vaccinated. Our experience on recent tours, now we're getting into the travel side of thing, we definitely are running tours. We've run quite a few tours, all of them so far in the United States, many of them in Montana, where we've created the Travel Montana brand. We require everyone to be tested, recently infected and recovered, or vaccinated. Mask wearing is optional. We explain the positives and negatives. We explain who else on the tour is vaccinated or tested, and we let people decide. And what people are deciding for the most part is that our travel bubble is safe and we're not generally wearing masks in the vans. That's going to change with Delta. We're going to recommend more mask wearing in vans, but it is what's been happening. We are definitely still trying to keep in our travel bubble. We're trying to stay outdoor dining, or if we're indoor, keeping our own group. We're trying to limit our interaction with others who aren't vaccinated. And the whole thing is working. We have not had any known cases of infection after our tours. So that's awesome. What we're doing is working, and it has been safe on our tours. But I want to go further and tell you about the Wine Media Conference, because now we're talking a whole different animal. Instead of 15 people on a tour, we've got 10 times that, 142 attendees actually showed up. That's a smaller number than our regular conference. Some people are not attending conferences still. We were indoors, and yet we required everyone to be vaccinated, tested, or recently infected and recovered. Everybody, all 142 people, showed up vaccinated. Amazing. We had some mask wearing, which we encouraged, but it wasn't ubiquitous. We definitely did it a lot on the transportation, but there were times, because it's a wine conference, where we were drinking and eating, and it was just difficult to wear the masks. We had one positive case after returning home. That was a week ago today. That person was coming from a high contagion area, and the infection came about at a time right after the conference that we don't know if that person was infected at the conference or potentially before. However, nobody else has told us that they have had a positive infection. We've alerted everybody and asked them to alert us. And so it's distinctly possible that there was no community spread at this conference and that our policies were basically a success. And so the conclusion is that the whole vaccination thing, travel bubble, works and makes it safe if you can do that. And mask wearing is really just a bonus in there. So our recommendations, which come in part from the CDC, right? The CDC recommends wearing masks indoors when in areas of substantial or high transmission. This is most of the US now, so I would ignore that and just say the CDC is recommending mask wearing indoors. My recommendations, obviously, get vaccinated if you're not yet. Most of you are. Wear your masks indoors, especially in larger groups, especially when you're with people who you don't know their status. Try to associate with those who are vaccinated. I had a wine tasting party at my house 2 days ago, and it was outdoors, and I required everyone to be vaccinated. I didn't hear a thing about that. Everyone just showed up vaccinated. I didn't test them. I didn't check their vaccination status like we do on tours and conferences, but I'm pretty confident everybody was, and it makes us all feel a lot better. I don't really go into bars at this point, and I'm not going into restaurants unless I know that I can be sitting in an area where I'm not next to other people. Because you then don't know that you are not sitting next to someone who's nearby you and is unvaccinated. Get tested if you have exposure. We kind of got out of the testing habit, right? But I got myself tested after I heard that there was someone at the conference who was positive, and luckily I was negative, but it's certainly nice to know that. And I canceled a few plans in between. And be much more cautious if you have a unvaccinated child. It changes things. You do not want your kid to go get COVID because you're vaccinated and feeling safe. So I would be more cautious with that if that's the case in your family. On our tours, we're doing this exact same thing, right? We're requiring the vaccine negative test for recent infection and recovery for U.S. tours. We're requiring a vaccine for foreign tours, which I'll talk about later. We're still trying to maintain our travel bubbles. We are emphasizing more the masks in vans where we're really in tight quarters, just because of the possibility of vaccinated people being infected and infectious. And we're still trying to eat outdoors and keep our travel bubbles safe. I do want to point out a lot of what I consider strong positives here. Obviously, there's been a surge in vaccination rates recently with Delta. That's good. But in addition, there are serious reasons people are going to want to be getting vaccinated in addition to the threat of Delta. And these are mandates. And look at this list of places that are mandating vaccines. I don't have to read these out for you, but it's really amazing that this is happening. Note there in the major companies that are doing this, there are a lot of caveats. Some companies are saying, yes, we're requiring them for new hires. We're requiring them for people who want to travel. We're requiring them, but not right now. We're going to do it later we're requiring them if you come into the office. It doesn't matter. People are getting there. It's great. There are restrictions on the unvaccinated. New York City, San Francisco, and New Orleans has a ban on restaurant and gyms. I'm just outside New York City. I've read what's going on. It's not just restaurants and gyms. It's zoos and museums and bars. You can't go down to your local bar and have a beer and eat indoors if you're not vaccinated. And right now, that might not be a big deal in August, but come November, December, when it's cold out, I think a lot of people are going to get vaccinated, especially younger people, because they kind of have to if they want to live their normal life. Sporting events are requiring vaccine or negative tests to come in and watch football games, things like that. So this is a big, big movement in favor of vaccinations, and it will help us defeat Delta much more quickly than we would if this was not going on. Interesting, here's another way to encourage this. Germany is charging for COVID tests for the unvaccinated. I don't think we're getting there. I'm pretty sure that our health system is going to say, well, we don't want to do that because we want to encourage vaccination or COVID tests, but nevertheless, it is something that's happening out there. And ultimately, there are some countries, Indonesia and Turkmenistan, which are, right on the top of your travel list, are mandating vaccines for everyone. But the important thing is, this is where we should be, mandating vaccines, really, as much as possible, right? But we can't. It just doesn't work in a free society. And so we're going the other routes. But there are countries that are doing this. There could be other countries that might be on your list of places you want to travel that will go that route. So another issue on travel for all of you. So what does that last slide mean about travel? Well, if there are vaccine restrictions on the unvaccinated in places like New York, San Francisco, New Orleans, sporting events, and that could grow, right? That could become New York State and California. Then you're going to have to be vaccinated in order to participate in a lot of regular travel stuff. Well, this is already happening in Europe, right? So they already have a requirement of vaccination, recent negative tests, or recent infection and recovery to go into restaurants for everybody. I wrote locals, but really it's for everybody, right? And for travelers, that negative test isn't realistic. You can't go to Europe and then plan to get a test every 3 days, which is how often you would need to do that for that to be applicable. So really, you're talking about if you want to go to Europe, you kind of have to be vaccinated. That's why we require that. They're using the green pass, sometimes different by country. I have not seen anything other than the statement that your US vaccine card is the equivalent of a green pass. So when you join us in Europe this year, you will have to be vaccinated to be on our tour. You'll potentially need to be vaccinated to get into the country, and you will need to have that vaccine card with you in person or even just a copy on your cell phone to be able to go into restaurants and other places like breweries and wineries. So that all is fine because most everybody's vaccinated. We're requiring it. It's not a big deal at all that Europeans are requiring it. In fact, we like that because that just makes us much more safe, as is shown by our experience at the Wine Media Conference. Here's the access to Europe information that was very big in the news about 10 days ago. Europe has a safe travel list. The US was added to the safe travel list on June 16th. It allowed us to go into Europe without quarantine if we showed a negative PCR test. The US now has case numbers that make us ineligible for that list. And so the question is, will the EU, the European Union, drop the US from its safe travel list? And the answer is it's complicated because much of the world, including Europe, might quickly become ineligible for their safe travel list. In addition, the EU really wants US travelers for their economy, and they want to have rules that are reciprocated by the US. And you have to remember that the US still has rules that essentially don't let anybody else come into the US for vacation reasons right now. And so what we think is going to happen is that the EU will either remove the US and other countries from its safe travel list, or just as likely scrap that list altogether. And what they'll replace it with is an exemption for vaccinated travelers. They will say you can come into the European Union without quarantine if you're vaccinated. That's clearly where it's going to go. That's clearly where we want it to go, really. And then the US has to decide the same thing. We announced August 5th that we are now looking at that exact thing. The federal government has not until recently started promoting vaccines in a mandatory way. And even now, when we say military members have to be vaccinated, there are often exemptions for allowing people to be tested multiple times a week instead. We're just very hesitant to demand vaccinations of anybody because of our love of freedom in this country. But the Europeans are less likely to have that qualm, and so this is where we're probably headed. And the good indicator is that Germany, just 3 days ago or 4 days ago, removed the US from its safe travel list and requires travelers to be vaccinated. So if you're signed up for our tours in Italy or another country, it's very, very likely that there will be a change to the rules, and that change will allow us to enter if we're vaccinated. I'm looking forward to that change because that kind of cements in place the policy, whereas right now we're on this safe travel list, which is too easily changed. So what we're really hoping is that that happens soon, and the EU and Italy and our other countries where we're traveling do this so that the uncertainty is gone, and we will quickly come out and tell you this so that you can move forward. If you're booking airfares, and some of our tours are happening at the end of August in Europe, you've already booked your airfare. At this point, you're probably fine. It is legal to travel to Europe right now for Americans. You just have to show your vaccination card. And if there's any change, my strong guess is that it's just going to be a change to make that vaccination a priority. So, you know, are there risks to traveling abroad? This is important for you to consider, right? And so far, most of our travelers most travelers are not traveling abroad, but that's going to be changing, and that's changing with us too. So if you're vaccinated, there's really no higher risk of traveling than staying at home, as long as you're still practicing safe practices that you would be doing at home. In fact, it could be that your safety is higher because the US is now really poor in terms of infection rates. So if you can keep your travel bubble, if you're going to an area that's not really in a major surge, then I think you're safe if you're vaccinated to travel abroad right now. There is a risk that the US is requiring a test to return home, right? It's an antigen rapid test is what's required, or a PCR. And it's possible that you could get infected even though you're vaccinated and then get stuck in Europe. So that is a real risk. I believe it's a low risk. If you look at our wine media conference where we had 142 people going there, and all were vaccinated and one was infected, and we don't know what that person was doing in her high infected area of the country before that, I think your risk for this is low. If the US changes its policy and allows in vaccinated travelers, then they'll stop checking for the tests, and then it's really up to you. If you don't feel like you're infected, then you can jump on that plane, and that risk goes away, really. As we talked about internally, that's a very low risk, and if you happen to get stuck in Italy for another 10 days while you recovered, well, that's not the worst thing to happen in the world, right? And I just want to quickly talk about that US test too. That test is easy to get, meaning it's an antigen or PCR test in Europe. All the major airports have testing facilities at their airport over there in Europe right now. You can schedule a test for the time you're going to be at the airport. You just have to allow yourself an extra hour. The antigen tests come back in 30 minutes, 20 minutes. So it's very quick. It's not a problem. And then you also have the option of doing it outside the airport before you even get there. A lot of major hotels are providing that information. If you're with us on a tour and traveling to Europe, we will know in advance where you can get tested. We'll probably all figure it out and all go sort of the same place and put that time into the tour so that we can get tested and make sure we're done with it. And I'm a little ahead of myself. So this is the antigen tests, the hotels, and the airports. So here are some conclusions. we have the ability to conquer this virus by vaccinating everyone. If we don't conquer this virus, it's because we don't vaccinate everyone. And we won't, because of the nature of human beings, right? That is what it is. This is why the scientists are pushing so hard to get the numbers of vaccination numbers up so that we get to the point where that virus doesn't spread. The vaccination numbers are moving again in the right direction. I really think this is a positive sign, and with those motivating factors we talked about. And it's possible, ultimately, that COVID's not going away. It's going to be managed. It's going to be managed like the flu. We're going to have to get a COVID shot every single year. And ultimately, you might get it. You maybe will get it over the next couple of years. And that if your vaccine is effective, then you're not going to be that negatively affected by COVID. And at that point, then COVID becomes a manageable factor of life. And we're kind of getting there anyway with vaccines. So get vaccinated, take precautions, proceed with your life, including travel. That's sort of my conclusion to all of this. So I do think it's safe. And I'm definitely under the 30 minutes. So I'm going to go back here, close out, bring myself back up, and go to some of the comments that might be on there. And I see questions. We got 8 of them. So what's the status of Greece? I don't know. It's a good question. I haven't checked all countries. We don't go to Greece this summer, so I can't tell you. I can tell you this. The best single source of information for Americans in any one country is to go to the U.S. Embassy website. So if you type in U.S. Embassy Greece COVID restrictions, the first thing on Google will pop up will be a page on the U.S. Embassy website in Greece, and they all follow the same system. Some of the information is rote, but you get down there and it gives you good information about what the entry requirements are and what the internal restrictions are, if any, and what information sources there are internally. Is the situation in Italy due to change at August 31st? I don't think there's anything about August 31st. The situation changed on August 6th already, which is that they started requiring the green card. And the next change that we expect to have happen throughout all of Europe is for the EU to say that they're scrapping or taking the US off that safe list and allowing vaccinated travelers. How do you obtain health travel pass for Europe? So I don't know what a health travel pass is, Mary. There's the green pass, and that's what we've sort of been talking about. So I might have answered your question. The green pass is the EU authorized pass, which is distributed or organized by individual countries. They get to choose how to implement it. And that isn't a health travel pass. It's a green pass showing that you've been vaccinated, haven't had a recent, in the last 3 days, negative PCR test or recent infection recovery. And that's the pass that you need to pay attention to. That's not eligible. The green pass itself is only eligible if you're a resident. There are some ways to get it if you're a traveler, but it's not really being done in that way. They're basically saying if you show up with a U.S. vaccination little white card, then that's the equivalent of the green pass. From what you know, have offers of travel discounts or packages been a good incentive for people to get the vaccine? That's a great question. I have not heard of any discounts given to vaccinated travelers. I think that we're way ahead on requirements for vaccines by requiring these 3 things, which we announced back in January, and now we're requiring vaccines for Europe travel. I haven't heard of any discounts if you're vaccinated. That's a good question. If anybody has that information, please share it in the comments because I'd love to hear about it. I am going to share this too. I think that right now, I know right now from my research that motivation to travel, what they call the travel sentiment, is way down compared to where it was 2 months ago. That means that people are not booking travel as much as they were 2 months ago. And that means that the airlines and hotels for the upcoming months are hurting again. And so I do know that you can get better deals now than you have been able to get. There was a point of time there where rental car companies, hotels, and airlines were all jacking up their prices because their supply was limited, not the hotels, but the other two, and the demand was back up. That has changed now. When I've been looking at flights to Italy, I saw flights for me from $600, which is half what it had been 2 years ago for a relatively, popular season this fall. So it's not a bad idea to look at travel right now. If you're talking about travel to Europe, I would book travel that's refundable. Travel in the U.S., it's fine. I don't have any issues with that at all. But I don't have a problem booking travel now for the coming months if you're vaccinated. And Alina wrote in there, I know some businesses have offered incentives like free drinks, apps, casinos have offered free play, but I haven't heard any discounts for travel. Yeah, as neither have I. Have a bunch of people canceled tours recently with your company? Great question. That's also from Isaac. Let me tell you that we had 50-some cancellations for our wine media conference, but that's a different animal because it's a big group and we're indoors. We had most people roll over their registrations from tours from 2020 to 2021. Most people just rolled it over right away. We did have some cancellations, but it wasn't a huge number last year. This year, for the most part, people are staying with us. I can tell you this, we have, if our European tours run, we will be something like 30% higher in total bookings than we were in 2019 pre-COVID. And that's in large part because travel demand is skyrocketed and our US tours are much more popular. We usually do most of our travel abroad, and we're doing an awful lot in the US in part thanks to Travel Montana, in part because of the demand, and obviously those two are related. So we haven't had a ton of cancellations. I can tell you that once we say to people, okay, this European tour is going, then we have gotten cancellations for Europe as people, I think, get nervous when we get down to the wire. That's one of the reasons we're having this webinar tonight. What lessons were learned from the Wine Media Conference that will be carried over to future conferences? That's Alina, who's one of our friends from the wine media world. Yes, so the lessons are this. My biggest lesson is this one. We encouraged mask wearing strongly, and the very first event we did, we had a wine tasting event indoors, and obviously everybody immediately took their mask off. And I didn't envision that well enough, and I should have. And so we are going to not have, if possible, indoor events of wine and food tasting. Our next two conferences are the food media and beer media. Those are both outdoor conferences. And we have limited parts where we will be indoors and eating or drinking in both of those conferences. So I do think that the outdoors, the requiring vaccines or the testing, and encouraging mask wearing when you are indoors are three things we've been mostly doing and we'll emphasize more. And those same things apply to the tours too. How to obtain in Italy the test required to return home. Yeah, it's the same thing, really. The 3 days is, we had a comment in here on the comment that it's usually a 3-day. The good news is the US only requires this antigen test, right? It's a rapid test. You don't have to worry about the PCR test. And so, and frankly, you have a moral obligation not to get on that plane if you're infected. But if your antigen test says you're not infected, I don't think you have the moral obligation to go out and get a PCR test if you're feeling good. And so getting that antigen test can get immediate results, and you have to have that test 3 days, usually 72 hours, so they're very exact, before you board your plane. And so it's very specific, but with the antigen test being so rapid in the result, it's not a problem at all. And we talked a little bit about how you can get those at the airport or at hotels, or if the hotels don't actually have them, they usually tell you where you can get them right nearby. And again, somebody asked about the test type. This is a great question. What's the bubble? I'm assuming everybody knows that because I've been talking about it for a year and a half now. The travel bubble is knowing who you're interacting with. It's the group of people you're interacting with. On the tour, it's your guide and all your fellow travelers. And by making sure everyone's vaccinated or tested with PCR, we are in a travel bubble where we know that everybody who shows up is very, very likely not to be infected. That's down a little bit with Delta, but not much, right? And that's your travel bubble. And so when you come on a tour, you can stay safe with us in our travel bubble. And then what we try to do to keep it a bubble is not expose our group to other people who might be unvaccinated. If you're traveling on your own, you can do that same thing. You just have to be cautious. It means cautious about going into places like restaurants and eating indoors when you don't know who's right next to you, or for that matter, at the other side of the restaurant and the AC system is pushing that air over to you. So that is your travel bubble. What's the status of travel in Costa Rica? Again, I don't know because I haven't checked all of this. I would check their website. Can you print your medical records showing vaccination? Our hospital system does not provide vaccination cards. That's amazing. I thought those were ubiquitous. So I'm hoping the presentation of how you show vaccination doesn't matter. I don't think it matters. Certainly in the US, it probably is not going to matter. If you have a state that has a vaccine app, like New York has the Excelsior app, you can do it. You can upload your hospital record and then show that you're vaccinated, and then that app will show that you're vaccinated, and you could use that. In Europe, I'm pretty confident that your medical record will work. If you are traveling with us on a tour to Europe this year, then let us know, and we will try and check that for you for your country. You mentioned possibly getting stuck in Europe if you test positive before coming home. I would assume that would be on my own dime. Yeah, I mean, we're not going to pay for it, and the US government's not going to pay for it, and the foreign government's not going to pay for it. That is going to be on your own dime. Again, we think that risk is very low, right? We had 142 people, 141 weren't vaccinated. We don't know what the one person who got, 141 were not infected, and we don't know what the one person's lifestyle was like prior to that. So with our safety precautions, being vaccinated, staying in a bubble, wearing masks when important, we think that your risk is very low for this. Do you have any awareness on how much travel insurance helps you if you get stuck abroad recovering from COVID? Great question. Travel insurance, we didn't really cover that, Jill. Here's the deal with travel insurance. The travel companies don't want to pay out if they can help it. And they definitely don't want to pay out for a pandemic when they know they're in a pandemic. It's a pre-known existing risk. So you have to, the only answer I can give you is you have to check very quickly, very accurately what the conditions are that are listed in your travel insurance. And you need to probably pay more to get insurance that specifically covers you for a pandemic. They have insurance that does do that, insurance that doesn't, and they charge you more for that. So I think you will find that specific answer in the travel insurance that you're looking at. Does international health insurance exist if you get sick in Europe? So it's a great question. I have lived abroad twice in Europe and had to go use the health system both times. Both times, I was never even asked for my insurance. They generally have insurance for everybody, and so you would just go in there and get your health care, and it was awesome. That's one possibility. Another possibility, and by the way, I've also done this. I remember going into England. I got a severe cold, and I had to go in there. I had an ear infection in England. I had to go in and to a clinic, and my insurance. I can't even remember if they asked me for insurance. I think I paid a very moderate fee, and had that done there too. So the answer is, if you have U.S. insurance, it might or might not cover you abroad. You can get specific international health insurance, then yes, it will cover you abroad, and probably you're going to be good anyway in Europe, where the health system is excellent. What's going to be the COVID status requirement to attend the Food Bloggers Conference? We're, like a lot of people, hesitant to require people to get the vaccine because of the pushback from a big section of the country. However, we know that our audience, the people that pay attention to me when I'm talking about this stuff, are generally in alignment with me. And we're talking about this with the Food Blogger Conference too. So it will be the same thing. We will be requiring negative PCR test, a recent infection recovery, or vaccination. And I would guess that 98% of the people are going to be vaccinated. And we will check the PCR status of anybody who's not. They can go to US Gov to get the QR code for proof of vaccination. Now, that's an answer from Mary Caldwell, who says that if you don't have your vaccine card, you can go to us.gov and hopefully find your name in there and get proof of vaccination that way. Somebody's asking about the situation specifically in Siena, Italy for the November trip. That I do know more, because we're looking at Italy a lot. We have about 5 tours running in Italy. Italy has been very good. Their vaccination status is now higher than the United States. Their number of cases per capita is lower than the United States. They are farther along in allowing vaccinated people to do things. And so it's pretty good in terms of put it this way, it's probably better in Siena than it is where you live. And that's certainly true if you're in Florida or Texas or Georgia or someplace like that. And if you're vaccinated, then you're going to have the ability to do everything that we need to do while we're over there. And just to be very specific, we've talked to all of our winery providers and our activity providers on our wine tours over there, for example. And the answer is, yes, we can accommodate your group. And that group that David's asking about is specifically a group where we have 31 people registered. It's a larger group than we normally run. And we have our wineries saying that, yes, we can handle your groups over there. So the activities, the tour is going to run just as planned. That's everything we have. We're up to 284 people that were either on or going to watch it later. I appreciate your time. I hope this was helpful. Feel free to continue commenting. Feel free to email me, Allan, ALLAN, @zephyrunited.com. If you have any hesitations, if you're signed up for a tour and you have hesitations, if you're not signed up and thinking about it, let us know. Let me know. I would love to help you out. I can't help you out specifically on countries where we're not traveling, because I don't research all of those. We have a lot of availability because we added in a lot of tours this year. We have 3 great tours running in Vermont, a biking, a hiking, and a multi-sport beer tour. The biking tour is sold out. We have space on the other 2. We still have space on our wolf tour in Montana. We have space on some of our Puglia biking and a number of other tours. And we would love to have you join us. We're confident we can keep everybody safe. We can't guarantee that, but we're doing a great job so far. Our success record is high, and we think we're not going to be jeopardizing that by continuing to running tours. So thank you, everybody. It was fun for me. I hope you got something out of it, and we hope to see you this year on the road.